Hi, I'm Rupert Schofield, President and CEO of Think International, the microfinance network, and host of the Social Enterprise podcast. With me in today's session is Shoga and Genevieve Oni and Joe McCord, co founders of a fascinating organization called MDOS, operating in the healthcare space in Nigeria. So tell me about your company. Where did the idea come from? Because it's not a usual path for people to take to set up a company in Nigeria working in the healthcare space. Um,
Thanks for having us here. So the company MDAS, what we do is we build and operate modern tech-enabled diagnostic clinics in clinically underserved communities in Nigeria, starting with Nigeria. And the idea, what it came from is I was taking a class at MIT, and during that class, the challenge of the class was to build a product for 1 billion people. And that took me back to a visit I had with my dad's clinic, where he complained so much about how hard it was to source, maintain um, medical equipment for his patients. And so, being an engineer, I thought it was just a pure um, engineering problem. So, it's a technical problem, we're going to solve it in a technical way. So, we quickly figured out how we source equipment from the States, refurbished equipment which are cheaper, more value for the customers who are mostly low income. And then um, we figured out what to source it, refurbish it, install it, and maintain it for those types of doctors. That's where the core of the idea started from. Um, During that class, I met Joe at the time. He had done some work in Nigeria as a supply chain specialist, so we were just a natural fit for what we wanted to do at the time. And then I met Genevieve, and on our first date, we were talking a lot about our experiences in the medical space in Africa, and she told me she'd been in Uganda and shared some of the things that I'd seen in my dad's clinic. So for our second date, I took her to that class because I was presenting there. It was like literally 3 minute presentation or 2 minute presentation, but she came, so she's a keeper. Uh, well, the three of us decided that we were going to focus on this and do this. So, but that was the core of the idea that the diagnostics eventually came from. So we did the first idea, the sourcing, installation, and maintaining business for 2 years. And at that point, we saw some really clear gaps in the marketplace. Uh, Being on the ground opens your eyes to many things. And so we saw that the problem wasn't just technical, wasn't just about equipment sourcing, installation, was that a lot of the patients are actually quite low income. And because of that, the hospitals are not able to afford any of the equipments they need. They can't say enough, they don't have enough volumes to justify spending the money to buy those big equipments. So, and we saw them coming to us, but always complaining about how they couldn't afford it. So we decided to pilot our new model, which was how about we aggregate demand from multiple clinics and build the best in class diagnostic center where they can all refer to. So that way they get good quality diagnostic services. We are able to see enough volumes to justify having all of the equipments there. And we that's what we did.
cool. Well, let me back you up a bit because we are just entering the healthcare space, and you are our first investee of our company, Think of Ventures. And frankly, healthcare is the last sector we entered, probably because I don't understand it very well. It's a huge, it's a huge space, kind of intimidating to people like me. You've connected some dots for me. Your dad is a doctor, so that explains a lot. But um, was that really why you got into what you're doing? I mean, I guess to cut to the chase, how come your dad didn't say, son, I want you to be a doctor like me? Or did he? And you said, I have other
So
ideas.
I was lucky enough that I wasn't the first child. The first
Okay.
child is a doctor, so
Oh,
he
wow.
takes
All right.
the box already from my dad,
Uh,
and I'm a little bit of what will you say? I call it. My parents love me, but I'm a little bit of the black sheep of the family in that I can just do whatever I want. And this problem was very compelling for me, given that um, I've been around healthcare all my life. Like my brother's a doctor, my dad's a doctor, my sister's a nurse, my brother researches cancer. So I've been around this. This is my life. So even as an engineer, when I was thinking about the problem to solve, it just naturally felt right that it should be in the healthcare space.
Makes sense. Genevieve, let me bring you in here. I believe you worked in Uganda, right?
Yes.
And
correct.
did you see the same kinds of issues?
Mhm.
You worked in healthcare.
I did, yeah. I worked in healthcare in a rural part of southwestern Uganda, and one of the biggest complaints that the doctors and clinicians that I worked with was around getting access to good medical equipment. And almost every hospital and clinic and lab that I visited could take me to a back room where they had broken down devices that were some of which were donated and maybe they never worked, maybe they worked for a few months before running out of disposables. There were a lot of complaints around being able to adequately maintain equipment and getting access to good biomedical engineers. And I could really see how much that affected the doctors because I felt like they just could never really get to the right diagnosis for a lot of their patients, and seeing the effect that that had on the healthcare ecosystem overall, realizing that you're not able to provide the quality of care that you would like to, and treating just to clinical signs and symptoms is often just not enough to be able to really solve a patient's healthcare challenge. So it was interesting for me that that question came up over and over and again of how can you help me get better equipment, and how can I be better enabled to do my job as a medical doctor working in a low income and rural setting.
Okay, so after Nigeria, it's back to Uganda, right? To set up
Hopefully,
shop
definitely.
there.
Our big vision
That'll be
is to
number
scale
2, right?
for sure. Yep.
Okay, and this is kind of a more general question, but what would you say in Uganda was the most prevalent or the most urgent need for what type of equipment? I'm going to imagine it's not to do MRIs on ankle replacements. Probably not.
Probably not. Yeah, we didn't see a huge demand from the doctors for things like MRI and CT, although I'm sure they would love to have those modalities. A lot of it was around maternal care, so being able to do obstetric scans for pregnant women, knowing if there might be complications in the delivery ahead of time is really important. And then a lot of the lab testing as well, so testing for things like malaria, tuberculosis, getting even basic things, STI testing done, is very important, especially with communicable diseases, because you don't want patients then going back and potentially infecting their families. I think the biggest demands that I saw were maternal and child health and for infectious disease testing.
Okay, great. Joe, let's bring you in here. Now, I'm going to guess you're on the logistics side, trying to figure out how to move this stuff from one locale to another.
Point A to point B, that's right.
Okay.
My background is in supply chain management.
Cool. All right. Can you give me like some kind of a typical problem you're working on, maybe now, and what are you thinking in terms of how you're going to solve it?
Yeah, so one area we're working on is managing the consumables that we use for our x-rays and our lab services.
Which is a lot.
So we need to build a system that captures the consumption and the stock on hand for those different consumables, and then figure out a way to get those consumables to the clinics that we're setting up.
Okay, you're going to lose me a bit on the jargon here. A consumable to me is like a tomato or something. That's not what you're talking about.
No, things like x-ray film that we use to print out some of the x-rays, some of the reagents that we use for laboratory testing. All those need to be in place in order to provide the services that we offer.
Great. So, so tell me where the company is like right now, and how did you act? Let's go kind of backwards, maybe, or whatever. How did you get to where you are now? Was it like, nothing, you know?
It's taken us a long time. So we spent 2 years in the equipment business before we pivoted our business model in 2017.
Mm-hmm.
And that's when things really took off because at that point, one of the things that we did was provide the best in class patient experience for the patients in the locality. And so people loved what we were, they loved our location, so a lot of people came. And so that was the first sign that we were onto something. And so we quickly tried to get support, more support for what we were doing because we wanted to really scale it. Because healthcare business is really low margin, but if you can get it to a lot of people, then you can make actually true impact. And so a lot of what our thinking then was like, how do we get this from just one clinic to like 5 clinics, from 5 to 20, from 20 to 100, and that's the journey we're navigating right now. And so we were part of Techstars last year, which is a incubator or accelerator in the states here in Texas, and they gave us a lot of the support we needed, and that enabled us to raise about $1 million. And that $1 million is helping us now build the next set of centers. So at the moment, we're building 2 locations. We're super duper excited about it because I feel like this also gives us an opportunity to test some of our assumptions about some of the other things we want to do. Eventually, we want to go into primary care. So I think that this expansion gives us like enough um, fuel in the tank to be able to test some of those ideas we have. And this also enables us to broaden access to healthcare procedures for people and also monitor them. So
Mhm.
it's great.
Okay, I think you kind of ran through the ground I was asking about like pretty fast. Can you give me some more of an idea of like what I mean? Because we started thinking, and I'm telling you, it took a long time, and figuring out a lot of stuff and surmounting a lot of obstacles and raising money. What was the biggest challenge you guys faced to get this thing off the
We face 2 big challenges, I would say. One is just getting, everybody knows, getting capital as an African company can be very, very difficult because you're also like so far away in many ways. I think that I give a lot of credit to Finker, and Alex, who came to see those clinics themselves and talk to some of those doctors and understand the pain points. I think many people weren't willing to do that kind of work, and I still say that the due diligence process we went through with Finker is like best, like was the best. Even you know, out of all of the other people we raised money from, is really great. And so getting people to understand the African healthcare challenge when their frame of reference is like mostly the US is kind of challenging. It takes a particular kind of person to do that. And number two was just like operations is always going to be a big headache for us. So hiring people, training them, we hire people from whoever is available to us. And at the beginning, we assume that, oh, everybody's a professional. So we're just going to hire 10 people, put you, say, hey, be professional, go away. We quickly learned that training people is really important to achieve. Like we have to be very, very intentional about the people we hire, how we hire them, making sure they have our values, and just making sure that they reflect our values to our patients because that's very, very important to us. And so those are 2 things that we had to navigate and we're still navigating. I don't know if you have any other ideas.
Yeah, I think I agree with that. A lot of what we're focusing on now is on this process of replication. So we've been running one facility and kind of all of our lives have been focused on making this center work and work really well and provide great care to our patients. And now with these additional centers coming online, we're working on kind of operationalizing what we do and really leaning on our staff that have worked with us for the past 2 years in that process as well to think about what will be changed with these new centers, how can we make our processes even better, and then how can we find, train, and retain the talent that we need in order to provide great care. Because at the end of the day, we're interacting with patients, and the people that are doing that are all of our staff at the center, and they're kind of the face of our company. So really working with them to think about what's gone well in the past and where is there even more room for improvement. So it's been really exciting.
Cool. So let me ask you, maybe this is a kind of strange question, but I always ask people in the medical field, are you saving people's lives by what you're doing? Would you say?
I think we are. I always struggle with that question because we are part of a larger ecosystem. So diagnostics is a critically important part of care. Obviously, we believe that strongly, otherwise we wouldn't be doing what we're doing. But it is kind of part of this chain of care. So I do believe that we are having a tangible impact on people's lives, and indeed saving lives or preventing preventable illnesses or helping people get diagnosed faster and treated faster. It's always tough to say, to have that direct link between a person comes
Take
into the
credit
center.
for it.
Yeah.
You have my
I
permission.
certainly think
Yeah,
that we are.
I do believe that we are saving lives, because in many of these places and in places we're looking to go to, a lot of the alternatives is people treat to clinical signs, and of course you get treated, but sometimes you think you have malaria but you don't have malaria, and if you get treated to clinical signs, you might die of a really common illness like typhoid because you didn't know
Sure.
you. So I think it's for that. I think doing that, and also like we are it's on our the local healthcare system is being strengthened by us because we provide better options than a lot of what exists locally. And one of the things we were proud of was that after we came into the marketplace, all of the existing diagnostic center all have to improve their facility. Everybody improved their facility. A year later, when I went there, we went there when we were about to start, and seeing the state of their facility was what gave us the confidence to say, hey, if the state of play here is look like this, then we can do something better. But a year later, we went over to those places, and a lot of them had improved because we were in the field, and patients stopped coming to the centers. And so for them to be able to give an argument to the hospitals that they should see patients, they have to improve their services. Actually, doing that is actually quite important for those that local care ecosystem. So
Mhm. So you speak of your patients. These are, tell me if I'm mistaken here, but I think what your patients are referred by other clinics, right?
a good chunk of them.
A good chunk, but
Yeah.
you actually have some walk-ins.
Yes, about 20% is what
Really?
that is. Yeah.
That's interesting.
Yeah. So and that's right now we see more and more walk-ins every month
Huh.
because at some point some people have actually cut off their primary care. Like they came to our center once, and the next time they needed to go to a healthcare clinic, they just came straight to us.
Okay.
So
Eliminating the middleman.
yeah, exactly. So we're still looking at the trends to see what to make of it, but we're happy about it.
Mm-hmm.
So-
Okay. So can you kind of give me a brief kind of band here of the types of stuff you diagnose?
Did you want to take that?
Sure. I mean, the services we provide cover imaging, which that covers our X-ray, ultrasound. We also do ECG. We also do lab work. So there's blood, for example, as well as a few other areas. So that can cover you for something as specific as a malaria test, but it can also cover chest X-rays, look for TB, obstetric ultrasounds to make sure that pregnancy is developing correctly.
Mm-hmm.
So it really runs the gamut. We cover about 200 procedures in
Yeah,
total.
200 or so tests. We also do brain tests and for EEGs.
Wow.
Yeah, so it's a good suite of tests we offer to the local ecosystem.
And we focus on both kind of the testing to treat a specific condition and also on preventative tests as well. So things like a pap test for women to screen for cervical cancer. And that's an area that we're particularly focusing on, is on the preventative healthcare side for non-communicable diseases like cancer, heart disease, and diabetes. So it's a little bit, it's always, preventative care is always a tough sell, but working to make it more affordable and accessible and increasing education among doctors and patients on the importance of that type of testing is an area that we have focused on and will continue to kind of do more with as we move forward.
Okay, so let me ask you a bit about why you guys got into this. And by that I mean why you got into healthcare in Nigeria. You were in Uganda previously, so how did you end up in Uganda?
Yeah, so I studied public health and African studies as an undergrad, and so the opportunity that I got to move to Uganda and work in the health sector there was kind of perfect. And I think I was trying to kind of trace back of why I chose to focus on healthcare even in undergrad, and I think it kind of stemmed from a place of wanting to help people and recognizing that healthcare. I grew up in Boston, so I grew up with some of the best healthcare in the world, arguably. I'm obviously a little biased. And seeing what an impact that had, being able to always have excellent care available to me and to my family members growing up. And then with some of the chances I had in college to travel to other parts of the world and other parts of the United States, and recognizing that that wasn't a given, really kind of ignited something in me. And it seems just like such a simple and basic thing that people should have access to. So I studied public health as an undergrad. I really liked thinking about healthcare systems as a whole, and how different pieces of healthcare fit together. So I got to do more of that with the work that I did in Uganda, mostly with the public healthcare system. And then the opportunity to think about the role that diagnostics plays as part of a larger healthcare system was really attractive. So that first day that I met Shoga, we talked a lot about medical equipment at the bar, which is a cool thing to do. It seemed like, yeah, this is something where there's a huge need and a lot of potential impact and a good way to spend your time.
Mm-hmm. Terrific. Now I know now. Oh, you got into it, Sugar. How about you, Joe? You come from a medical background?
No,
family,
entirely a supply chain business management background. The bulk of my career actually has been in development. So working in country level public healthcare systems on their pharmaceutical systems to make sure that they have a good supply of various drugs. And so one of the countries that I ended up working in a fair amount was Nigeria. And I thought that it was actually a lot of business opportunity there. It's a large population, a very entrepreneurial culture that exists there. And that interest in the healthcare space and my experience in the healthcare space is what eventually got me connected to Shoka while we were in grad school.
Mm-hmm. Okay. And so I think our people would be interested in hearing how much value you put on this kind of accelerator experience. Was that slightly helpful, really helpful, something in the middle?
Yeah, I thought Texas was great for us. I think that we were there at the right time, and then it also helped when you work in the business. Sometimes you get tunnel vision and you don't see the bigger picture, and so I think last year taking us out of there to actually see how can this develop over time. What is the game plan here was actually I think was changing, was like game changing for us to say, you know what, this is how. Sometimes we know the goals we want to achieve, but sometimes it's nebulous how you get there. And I think being a part of it was kind of helped us say, hey, this is the rough outline of how we get to where we need to get to. This is like the 5, 6, 7 checkpoints we need to get to be able to achieve our goals. I think that's the biggest value that we got from them. And then once we were done, they were able to connect us to people they know.
Mm-hmm.
And I think that's how actually we got in contact with some thinker. So
Yeah.
Mm-hmm.
One thing I particularly loved, in addition to everything Shoga said, was they put a lot of emphasis on key performance indicators and tracking key data about your company on a weekly level. And we had to run little micro tests every week to try and learn something new about our business. And that's a practice that we continued even after the program. But I really liked how they kind of gave us a framework and helped us think about what is something that you can be testing every single week so that you're continuing to learn about your customers, you're learning about your employees, you're learning about the services that you provide. And so that kind of instilling in us this culture of continuous learning and having a framework for doing that I found personally really valuable, and I think we've gotten a lot out of that even after the program.
Mhm. So you talked about your values, and that's kind of sometimes that's a bit questionable whether a company really believes in what they're saying or whether that they think it's just a great way, great PR or whatever. Where do your guys' values actually come from? I mean, did you guys get together and say this is what we want to be here?
So this is a something we developed when we were in Texas last summer, where we had a more than a week of continuous brainstorm about what we want our values to be, and to see. And I think a lot of where it comes from is to imagine a universe where 5 years from now, 10 years from now, where we're big company, we're everywhere. What kind of organization do we want to be? And then mapping out how to today is like how do we get there? So like one of the things is that one of our first values is to be people first. So people we just don't mean patients, we mean patients, our staff, our um, our employee staff, and the doctors we work with, and to just put them first and everything to make sure that we're human centered, that we don't make decisions just because of money, but that anything we do is always going to be tied to who are we helping here, and I think that that's quite important, and I think that even in our brief um, years of operation, I think that that's the number one thing that got us the traction we got, because when we went to the other centers, we didn't feel welcomed there. Like people felt as if they were doing us a favor to come to their facility, and so but when we started, like we had people that just had smiley faces, and you wouldn't know that smiling faces can be a competitive advantage, but it is when someone is in pain. Sometimes just seeing you and you just cheering up is something that will brighten their day that's actually a little bit miserable, you know. And so looking at that and then forming a culture, and like you said, values are something people say, but one of the things now we realized for the past years that we have to be intentional in the way we develop it. And that's one of the key lessons we've learned. So in the past 3 months, we've had conversations with our staff to say, hey, this is our values, and we just don't want to, tell you that this is our values. We want to show it to you. And so in the way we compensate them, we try to show it to them. In the way we help them, we try to show it to them that we actually care about you, so that you can care about our missions. So,
And is that working for you in terms of attracting new customers? Like, do you have people showing up say, "Hey, I just heard about you from somebody else"?
so it's hard for us. Hacks we don't necessarily track that, but we can see it in our numbers. So before, when we last year, our self-referred numbers was maybe like 20 a month, but now we're up to like 90 a month.
Mm.
And so we can see that people definitely like coming to us, and even some of the um, doctors that sometimes wouldn't refer to us because of like referral fees issues or whatnot. When their family needs to get healthcare done, they would come to us for their families healthcare, because just believe that we are the better option. So I think that we see it on our numbers, and we also do surveys um, now. And Finca is actually helping us with our next survey, which we're really pretty excited about, to make sure that keep getting feedback from the patients about like, is everything good? Is everything good? Are we meeting them at the point of their needs? So I think it's a continuous process.
That's good. So the public, the government, the regulatory framework, and so forth. Some people say it doesn't matter the country; it could be here. To say, God, these people just make work for us, regulate us. These, complying with this and that. What's the healthcare situation vis-a-vis that in Nigeria?
Yeah. So the healthcare sector is mostly regulated at the state level. So which is new state we go to, we have to go get a new
Mm.
license of operation and come inspect and all of that good stuff. Of course, with government, the bureaucracy is oh god, yes, you can imagine. And I think anytime you do something for the first time, it's usually the hardest. So when the first time we shipped, it took us like 6 months or so to figure out everything. It was painful. The last time we shipped took us like a month. We didn't. It was the smoothest, and it was the biggest shipment ever, smoothest shipment ever, because we've done it so many times. And I still feel like with all of this, um, for us going to different states is like a big headache because you have to go through the regulatory framework for that. So we're doing that for a couple of our new centers, and it's not fun to be honest, but that's something you have to do because you don't want them coming to your doors and saying that you didn't do something right. Which I feel like they slow. Sometimes that slows the pace of work down, but at this point it's a necessary evil. So we just calculate it into whatever calculations we make.
And it helps to steer patients away from the less scrupulous actors in the market as well, ones that otherwise wouldn't pass some of the basic regulatory requirements.
Yeah. I wish the government would actually go crack down. Crack down.
Oh, okay.
So, but that's a different conversation.
Yeah. Well, part of the reason I wanted Finca to do something in healthcare was one of our best clients in Uganda was a woman who just had an amazing story coming from nothing and building a thriving restaurant, buying a house, and so forth. But she regrettably got breast cancer, and she fell into the hands of some unscrupulous doctor who just, he just messed her all up, and eventually she passed away, sadly. But I thought, wow, this was our best client in Finca, most successful, and look what happened to her because she was led astray by this guy who didn't care about her. He's just trying to. She saw she had money, and he took all of it, and he left her a wreck. So I thought that's something we need to get involved in. But so okay, let's talk about. I'm not totally clear, frankly. I know what you do now. Thank you, Joe. How do you guys divide the work up? What are your
Yeah, I'm the CEO. But
Okay.
as a CEO, you do a little bit. I think right now we're still at the stage where we all do a little bit of everything. We have titles in name, but Joe also manages our tech for us and does like global partnerships for us in addition to all the supply chain work. I do a lot of operations. Genevieve does a lot of operations too, and then she's also our CFO. So
Oh,
so managing the books, making sure that also because we have we have some operations, a little bit of operations in the US and some in Nigeria. So yeah, we need to stay on top of things. So yeah.
great. Okay, well, let's talk about the future. Where do you guys see this whole thing going?
Yeah, so our big vision, so we have this funding right now, which is wonderful because it allows us to expand into more locations, serve more patients, test a lot of the assumptions that we have about what it will be like to replicate our model and to move into these new states, go through these new processes. So for our short-term goal, we'll be opening up 5 additional centers in Southwest Nigeria, which will enable us to serve thousands and thousands of more patients and gain all of this experience on hiring and training and creating a really seamless healthcare process for our patients. Longer term, we definitely want to expand further across Nigeria. And also, you mentioned earlier, aren't we heading to Uganda? And I certainly hope that we will expand to other parts of the continent because we've seen the challenges that we're addressing in many parts of sub-Saharan Africa. And we actually get requests pretty frequently, sometimes randomly through Twitter or our website, of people saying, hey, when are you coming to my country or my county? Which is really exciting for us to see and gives us that additional fire to grow faster. I think Shoga mentioned this before, but we're looking at, we obviously have this strong focus on diagnostics now, but what are the other verticals that we could go into to make the healthcare experience even more seamless for patients? So we're experimenting a little bit with the primary care space now, just because we've seen that demand from patients. I mentioned as well on the preventative care for non-communicable and lifestyle diseases like cancer and diabetes. So that's a space that we're working to do more in, particularly around patient education. And then also looking at other spaces we can play. So in verticals like dialysis, and then in the management of non-communicable diseases. So once a patient does get diagnosed, what role can we play in actually helping them stay healthy and remain healthy and live long, productive lives?
Mm-hmm.
So there's some of our big visions. We also are working hard on the technology side as well. So we describe ourselves as tech-enabled, which basically means that we want to combine that in-person, personalized, humanized healthcare experience, but have a technology piece as well, which will enable us to reach more patients and to be more efficient in what we do. So for example, all of our radiology images are read off-site by a radiologist or one of a couple that we work with in Lagos. So by centralizing reading of images, we're able to bring our services out to a lot more patients. So that's one way we've used technology so far, but looking at a lot of other things that we can do to help reach more patients, particularly as we look to move further down market and into more rural places. What role can that technology layer play in connecting patients with the care they need without physically sitting next to the doctor that they're working with?
Mm-hmm. So people are always telling me, focus, 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 focus. You know, they said, they would always tell me in the early days, Rupert, why don't you just work in Mexico? You could have a million clients just there. Why the heck are you going to Azerbaijan and Kyrgyzstan and going to Africa and Middle East and so forth? So do you guys get that? Like,
Yeah. That's what you. Well, I don't think that if we listen to that, we'll be where we are today, because people at the beginning was like just focus, focus, focus. But I think that in places where there's less infrastructure, where you have to do, if you want things done the right way, you most have to do it yourself. Um, and so if we feel like if people were doing diagnostic right, then we should have a thriving equipment business everywhere. And so we don't even need to get into diagnostics. So I think that right now diagnostics will be our core of what we do, but I think that there's um, interesting things that can happen around diagnostics, particularly given that we work in so many low income places. Um, there's only so much the patients can pay. So once you have 3, 4 people, different people doing 4 or 5 things the patients need, they can pay each of them. But if it's one person that's doing 4 of them, then it's probably slightly cheaper, and maybe the patients will be able to pay. And price is still the biggest barrier to getting healthcare in Nigeria. So that makes us, what we see is that we would have to do more things. But one thing we would always make sure is that our core is always going to be strong. So diagnostics, we always make sure that we keep going deeper and deeper, and making sure we're learning a lot of lessons and doing it in a way that nobody else can do it. But we would then look for opportunities around that, because I think that that's what will be exponential in what we do.
Mhm. You heard it, folks. Focus, not for us, right?
A little bit of focus, but like it's like, I think there are two extremes. So, but we have to like walk through those edges. Focus well on diagnostics, but also like look for opportunities on the side to do something interesting.
Genevieve, Showgood, Joe, a real pleasure talking to you today. I'm afraid we're running out of time. In the little time we have left, how are we going to get a hold of you guys if people are interested? Wow, these people look fascinating. I gotta know more. I want to give them a bunch of money because it sounds like they're really doing awesome work. So
We would love all those things. So our website is www.mdas.io. So that's mdaas.io. You can also reach out to us on Twitter at mdas global. So those are the best ways to find us.
folks, that's all the time we have. You can follow me at Rupert Schofield on Twitter, or thinka.org, or at Thinka.